This year, the Cosmetic Surgery Forum has been absolutely spectacular. We have stellar faculty, stellar attendees, and the rapport between everybody is absolutely amazing.
So many of the luminaries can speak about what their real passions are from the podium, talk about which devices they really use in their practice and how they use them on a day-to-day basis.
Within the last 2 years, we've had the FDA approval of both Kybella and also the Cool Mini. My goal was kind of to discuss the pros and cons of each, which patients you would choose for each, and how we use it in our practice, either together or separately.
After this meeting, I always bring back some efficiency pearls, some cosmetic pearls, some medical dermatology pearls that will share with my patients and share with my staff.
I would say that the most important thing that I presented was a new generation of hyaluronic acids that we already have in Europe for almost 2 years. They are completely free of BDDE, which is a toxic chemical necessary for the cross-linking process of fillers. It's much more natural than any injectable we know so far.
We also talked deeply about the effect of spent coffee grounds as a powerful adjuvant to any ultraviolet protection regimen, and it would imply to me that we've got to be looking at coffee as one of our major anti-sun damage ingredients.
The other exciting topic that we covered was that of hair growth, how to minimize damage, hair loss in women, how devastating it can be, as well as a variety of topical and oral supplements that are available to treat hair loss.
Learning about different uses for these neuromodulators. So we're talking way off-label use, really how we can improve like the nasal flare, how we can improve the tiptosis that occurs, how we can correct complications that occur from other physicians or other practices.
This year I did a just before and after picture of a couple patients. We presented how we treated the patient, and then we solicit from the crowd how they would treat the patient. And I think that having that dialogue between the attendees and the presenters is important.
We don't like to talk about complications very often, but it's really important that we understand them so that we can prevent them, and also if they do happen so that we know how to manage them.
And I discussed 4.0 megahertz radio wave surgery, and this is a way to make incisions in the skin with little or no bleeding. And when you have little or no bleeding, you have less bruising, faster healing, less pain.
I also got to help with the live injections. I got to work one-on-one with one of the faculty experts in injections, and that was just a great experience to be able to learn from him. And so I would definitely recommend this conference to anyone who's considering learning more about cosmetics and just wants to get a great experience overall. So thank you for the opportunity.